Dr. Gomez, can you tell us a little bit about the relationship between sort of the diet and mental health?
Sure. This is a really interesting topic, right? It's been there forever, right? So,
Okay. So quick question though, but how does something from my gut go and impact my brain? Like what's that pathway and how are they actually connected?
so this one of the
Do you think something like a ketogenic diet could be used to stabilize a disorder like bipolar disorder, for example?
so this is there's a lot of research going on. Usually, if you stick to the traditional diet of your people, right? If that's something you can say.
Yeah.
Not sure if you can say that nowadays.
Dr. Fabiano Gomes is a clinician scientist who has received his MD, his MSc, and PhD. He works as a psychiatrist and has received the Brain and Behavior Research Foundation Young Investigator Award, which is one of the most prestigious non-governmental foundations in the United States. He is also an associate editor for the Journal of Trends in Psychiatry and Psychotherapy.
All right, so thank you again and welcome to our podcast.
Okay.
Thank you.
Okay, so Dr. Gomez, can you tell us a little bit about the relationship between sort of the diet and mental health?
Sure. This is a really interesting topic, right? It's been there forever, right? So at first, people would notice that certain vitamin deficiencies, for example, could be related to neurological and mental symptoms. And this is since people would go into this, would traveling across the oceans, right, in the discoveries, and they noticed that would be a thing. So we do know that your nutritional status has a lot to do with, brain-based conditions, including psychiatric conditions, right? So this would be the first relationship between this. So having a good diet in a way that you are eating healthy foods, foods that have all the micro and macronutrients, it's really important. So this would be one of the first things we know. In recent years, a lot of studies, they have tried to understand if there is a relationship between what we call the Western diet, that it's usually diet that it's rich in highly processed foods, either junk foods, and food that are not more fresh, or that you don't have a lot of content of like fresh vegetables, fruits, even meat, with more traditional diets, right? Such as the Mediterranean diet, for example, that has a specific type of foods and elements that is related to that. And this was also related to the fact that if we notice that people in Western countries, especially US and North America, they have much higher rates of obesity, and also a lot of psychosocial and mental conditions arising in those specific populations, eventually compared with others. So this led to what's going on, right? And one thing that stands out, it's related to some lifestyle factors, such as physical activity and nutrition that leads to obesity. So all this research on obesity, physical inactivity, and dietary patterns, they've been there for a while. And then the mental health component came and they noticed, so now we have compelling evidence that across all age groups, the quality of the diet is related to more or less risk of a large different types of mental health conditions, from like anxiety to depression to substance use. So
would you include ADHD in that group?
ADHD, we have less of that, but it seems like the quality of the diet in ADHD children also can make it even worse.
Gotcha.
Right? So less evidence to like increasing the incidence of a causal factor, but definitely to aggravating the symptoms. For depression, we have some longitudinal studies showing even evidence for a causal effect, right? Or for being a major effect in increasing the risk of developing both anxiety and depression.
And this is sort of compared with the sort of standard American, the SAD diet, is that correct?
So usually what we know is that components of the diet, and there's a lot of debate on this, right? But especially highly processed foods and sugary drinks, they seem to be the most problematic component in this type of diets. You also can have different traditional diets that are more or less rich in carbohydrates, saturated or unsaturated fats. So, and then there's a bit more of debate about what would be the best diet. Most studies for overall health outcomes were done with the Mediterranean diet, right? So we have some evidence that sticking to a Mediterranean diet, it's likely helpful or would be beneficial for most people, but definitely Western diet with highly processed foods, you should stay away from it.
Okay. So quick question though, but how does something from my gut go and impact my brain? Like what's that pathway and how are they actually connected?
So this one of the main candidates of how to mediate this process, it's what we call the gut-brain axis, right? That it's mostly related to our microbiota. So it's the type of bacteria that we have. And we know that depending on the type of diet that you are exposed to, you can have changes in the microbiota. And depending on the type of bacteria that you have in your gut, you can have different outcomes. So some of the bacteria, they may produce more of anti or pro-inflammatory substances. So you can have an increased state of inflammation, for example. You can have what they call, one theory is called the leaky gut, where you have some of the bacteria is translocated from the gut to the bloodstream. So there are different ways that this might be related to. And it's also a two-way, right? So you have both influences in the brain within the gut, and this can have effects on your microbiota. And also, depending on the type of bacteria you have, they will mediate how most of your diet and the nutrients are absorbed or not. And also you can have like inflammation that would also be an important mediator in this process of communicating the brain with the gut. It's possible that other elements, like as the quality of the diet itself, the number of carbohydrates, the type of proteins, amino acids, and micronutrients would also be different, right? So it's not only the gut-brain axis, but also the quality of the diet itself.
One question I have actually is, so you mentioned sort of the Mediterranean diet almost as the standard. It looks like that's what it's becoming. Does this change for different ethnic groups? Because I would imagine, let's say my ancestors are from East Africa, and I've spoken to my parents about this, and they would say my great-grandparents would be drinking camel milk and eating only goats. Like that's what they did. Broccoli, spinach, all these things, they're not eating it. So for me, would that work for me? Or is it, can you talk about the genetic variation?
This is perfect. And most studies that criticize eventually even the Mediterranean diet is that it's possible that the main benefit it's when you have that specific group that evolved having that diet. So when I say that the Mediterranean diet has more evidence, it's more like they had studies, for example, people with hypertension, and then when you use specific diets such as the DASH diet or eventually the Mediterranean diet, because it's a more balanced diet and you don't have that much processed foods, people would show some benefits. But some other studies show that whatever diet that it's the natural diet or the traditional diet, to use the best term here, for that specific population is the best diet. So for example, for like Asian people, right, depending on when they are, they might drink a lot of soy products, right, and that's their traditional diet. So we think that depending on where you are, usually if you stick to that traditional diet, it will be good for you. The thing is, we have had introduction of these highly processed foods, a lot of additives and sugary drinks in all around the world. So you're changing the most traditional diets. And there is the issue of costs, right? Because sometimes they're more readily available, they're less expensive, but it will pay a cost in the end, right? So really great point. And just to make sure, usually if you stick to the traditional diet of your people, right? If that's something you can say. Not sure if you can say that nowadays, but if you can, it's good, right? And of course, if you are having, here in Canada, we are a multicultural country, right? So you go and eat everything. But if you're eating foods that are natural foods, that are fresh, and they're not highly processed, probably it will be the recipe to go to have a better health outcomes, and also to prevent even the incidence of some mental conditions, right?
Okay, so we're speaking about diets, and there's a huge trend of taking supplements, for example. This pill has 1000% of your daily recommended this and this. What's your opinion about something like that?
I mean, it's not necessarily an opinion, right? It's based on the data we have. So, of course, that if you have specific deficiencies and some vitamins, some oligo elements, we have some specific directions of how much you should take daily. And if you're not having that, probably you need some supplements, right? But usually, if you are on a diet that you're eating fresh food, fresh vegetables, you will have most of them. Depending on if you are vegetarian or vegan, you might need some extra supplements because some of those elements you need to get from animal products, right? So this would be the main indication to supplement something if you the type of diet that you have miss one or other specific element, right? So this would be the main thing. So, and most studies that try to supplement specific substances to prevent or to treat conditions, usually they didn't work. So as a general rule, we would say that most of the time you don't need to if you have a decent diet or a diet that is within most standards. And eventually if you have a specific deficiency, then you should supplement.
So I want to actually ask you now, there's a link as you described between what we eat and sort of our mood, how we feel. There's a clear connection. What diet and maybe what does the evidence say about certain diets and certain mental health outcomes?
Nice. That's another interesting area. We don't have a lot of solid research on this. So again, most epidemiological studies, some longitudinal studies show that the quality of diet matters. And it's mostly related to, again, fourth time, highly processed foods, sugary drinks. However, some interventions that helped to improve the quality of the diet, they were successful in as an adjunctive treatment to improve mood. So just by telling people which type of foods they should avoid and which type of foods they should eat, even without prescribing a specific diet, could help, right? Again, together with other treatments. We don't have any study that showed, for example, that the Mediterranean diet is necessarily better for mental health than another specific diet. There's one specific diet that we've been studying, and there's a lot of research currently on, that is the ketogenic diet, right? So the ketogenic diet can be used as a metabolic treatment to a number of different brain-based illnesses and conditions, but then it's a bit different than, let's say, what diet should I eat, right? In order to improve my mental health. In that way, it's mostly, even if you're just looking to prevention or milder cases, just by having a more natural diet, it will likely be important, more important than necessarily taking supplements or going that route.
Oh, okay. So can you actually explain to us what is a ketogenic diet?
Sure. So the ketogenic diet, as a medical and metabolic treatment, has been used for over 100 years in the treatment of treatment-resistant epilepsy, right? So it was really hard. I mean, 100 years ago, kids with epilepsy, there would be no treatment. And then they noticed that when they were fed a diet that was mostly comprised of proteins and fats, that would have an anti-seizure, anti-convulsant effect.
Wow.
Right?
That is shocking.
Yeah, did not expect that.
Yeah, and then, I mean, there's been a lot of research on that. It was mostly used for children, teenagers, and nowadays it's usually even used for adults. And even people that are on an anticonvulsant, they use as an adjunctive treatment. Sometimes they use for a while, eventually they are able to come off the diet. But it showed that had a really good effect. And what's that? So when you're eating a ketogenic diet, it's a low carb diet, so it's low on carbohydrates. There are usually sugar, starch, right? That's the type of foods that would eat carbohydrates. And that's most types of foods that we eat, especially in the highly processed food group. They have a high carbohydrate content, right? So you need to use low carbohydrates, and then most energy would come from fat, right? And that can be both animal and vegetable sources of fat, and also protein. you can have higher or lower contents of proteins too. And it doesn't need to be hypocaloric, so you don't need to be on low calories. So you can even have a normal or even a hypercaloric diet when you are on a ketogenic diet. So this is also one of the differences when you are doing, for example, weight loss. Usually you would need some sort of hypocaloric diet, right? Instead of just changing exactly what are the nutrients. I'm no specialist in, I'm not a nutritionist, right? And it's hard for me to talk about specific, differences on like weight loss. And so I will be more focusing on the mental health part, right? But what happens when you are on a ketogenic diet, if you're doing it properly, because of the low carbohydrate content, you will have a shift in using mostly glucose as the main energy source to using ketone bodies, right? The ketone bodies, they're derived mostly from fat that can be eaten from what you're ingesting or the fat that you'll be burning out of your own fat tissue because you are restricting calories from carbohydrates. So it's like as you were on a fasting. It's not the same thing, right? But when you have a drop in your intake of glucose, your body would say, okay, I need to save some of the glucose for my brain and some more vital organs that need that. And I will start using ketones as the main source of energy. But you can also use ketones in the brain, right? And they are a really effective energy source. So when you have this shift of using glucose to ketone bodies, at some point, it seems like the energy production is much more effective. And the theory is that you have a lot of different processes that are changed in the brain. You might use more effectively this energy, and brain processes are better, and you improve. And you can even have this change in the seizure threshold that helps with seizures as an anti-seizure medication. In your body, you have a number of different changes as well. Those ketone bodies, they are metabolized, and some of their metabolites you can measure in the blood and in the urine, so you can monitor what's the level of ketosis you're having. Sometimes in the beginning, you can have even some side effects. Some people would say that they are a bit more tired, they have less energy, brain fog. But usually after a couple of weeks, if you persist on that, your body gets used to this ketotic state, and you could have the benefits that in theory, and that's what we see in practice with some cases, and there are a lot of case reports right now, you have this improvement sometimes in mood, energy, and eventually even cognition, right? So this is something that we are really looking into. A lot of medications that we use for the treatment of mental conditions have this anti-seizure effect, right? And when they researched people with treatment-resistant epilepsy and looked into their quality of life and depression, they improved. So it's possible. And now there's a lot of different studies going on trying to see if we'll be finding the same good results we see in epilepsy.
So do you think something like a ketogenic diet could be used to stabilize a disorder like bipolar disorder, for example?
So this is, there's a lot of research going on. We have people with lived experience with bipolar disorder that have tried the ketogenic diet on their own or with help with some practitioners. There are a few groups that are starting to use the ketogenic diet clinically. And we are seeing what we call in science anecdotal reports, right, on that, some small case studies. And now we are seeing a lot of funding coming from people that are really interested in developing this field, and they're putting money into research. So we are seeing a lot of trials, and I'm part of a trial at Queen's University, promoted by Queen's, with Professor Elitsa Britsky. She's the main investigator, and one of the grants I got was related to this trial to see major depressive disorder, right? So mood disorders, that's my area. We have studies on depression, and we have a number of studies going on with bipolar disorder, and it makes a lot of sense because you have the anticonvulsants, the anti-seizure medications, they are used for mood stabilization. So that's the idea.
Wow, that's great. So my question, I guess, would be, how could you be sure that a ketogenic diet is the reason, as opposed to a person who's like, if they're trying the ketogenic diet, maybe they're removing all these carbs from, like you said, snacks and sodas and whatnot. Like, how do you know it's not that? Like, removing that from the diet isn't responsible for these better things?
That's a really good question. So it's possible that changing the diet itself might be important, the quality of the diet. One thing that we know is that sometimes just by changing the quality, you might not see these dramatic changes, right? So the studies, they are also trying to see which component of the diet, because it can be quite hard for some patients to actually get into ketosis. First, it can be hard, but it's possible. And we see a lot of people that they are able to get that. So our study is also trying to understand the feasibility, and it's possible, right? And sometimes people are really invested because they have tried a lot of different things and didn't work, right? Yeah. So it's possible, but it can be a bit hard, and you can have different levels of ketosis. So if we show that even a low level of ketosis, it's already improving, could be related to changes in the quality of diet. But for example, when you just change from a regular diet to, let's say, a different diet with less highly processed foods, you do see benefit, but it's usually not that, you don't see that marked improvement that we are seeing with the ketogenic diet. So it's possible that it's related to specific mechanisms of the ketosis. But that's a question that we are trying to answer to. And then we are able to measure the level of ketosis too, right? So for example, and if someone is on a ketosis, but then they lose it for a while because they ingested different foods, if we see a worsening of the symptoms, this could be another thing. Okay, so we need to get a sustained level of ketosis. So just to summarize, it's a specific treatment, right? That goes much beyond just, have a healthy diet to treat this. So we're talking about trying to optimize underlying conditions that we see that are abnormal and not working well with people with more severe mental illness. And it's possible that using in the shift in the metabolic pathways and using a different type of energy source might optimize internal processes such as the in the mitochondria, and the energy it's used much more efficiently, and then you could have the positive outcomes.
Okay.
Awesome.
I actually have one more question. I've been looking into a little bit, again, as a layperson, blood sugar's effect on sort of all of this sort of this, how you feel, your mood, and things of that nature. Could it be that when you're removing all this glucose from the form of carbohydrates, you're not having these big spikes? Do you know exactly, or are you trying to find out why the ketogenic diet is so effective compared to even a really healthy?
So that's the area that we need to be, because a lot of people that advocate in this space, they think that it's the main villain is the glucose, and it could be. And when we are using the ketogenic diet, you change, and people can even have a lot of improvements in their glucose levels and even diabetes, right? But again, we don't have enough evidence yet that just by using the ketogenic diet you will reverse, for example, diabetes, right? It seems like it can be an important treatment, and there are studies going on, and we have information about that. And again, I'm not an expert. In the mental health part, we know that hyperinsulinemia, right? When you have sustained levels of glucose, the hyperinsulinemia can lead to more inflammation that can lead to worsen, for example, in cognitive processes, right? So it's possible that part of the improvement we see with the ketogenic diet is related to using ketone bodies that would decrease the amount of glucose that we have, or the spikes of glucose that we have available, and you use it more effectively. So it's possible. One problem is outside of, really cutting edge research and really valid research, there's a lot of people just trying to sell whatever out there, right? That's why, I mean, I'm a bit skeptical in the way of just saying, I think this can be seems to be a really powerful treatment that will likely work for some people, right? And that might be able to get the diet, to use the diet, might be struggling with more treatment-resistant cases. And other people that do well on other treatments, they might just take to a specific treatment. And to say that the ketogenic diet is like a panacea that will be working for everything, that's not my position at this time. And even for, I mean, using the ketogenic diet on your own without a medical or another provider can be a problem, right? Because you can have side effects from the diet itself. Some people would come off medication, so you shouldn't do that. But if it's something that you are interested in, there are a number of different studies that are recruiting, and maybe someone could participate as a research volunteer. There's no one size fits all, right? Especially related to mental health. But it seems like this could be another tool if we get the data and the data is positive to help people that have, I mean, a lot of treatments have failed on them, right? So I think it's important to have research on safety and trying to understand who this would work for.
Okay.
Awesome. Thank
you
you
very
again
much.
for joining
Thank you.
us.